Hi, welcome to Healthcare in Context. My name is Charlotte Safrit. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hey, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott and White, and shortly after earning my MBA, I quit my job to start focusing full-time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
We want to remind everyone that we are not doctors. Anything we say here is not to be construed as medical advice.
Kaylene, Karol, thank you both for joining us today. We're going to start with just a little background and context around your story. As a reminder, we focus with this first interview on the screening and diagnosis portion of your story. And we also do not mention providers by name. No worries if you do, we can always bleep that out. But Karol, I'll jump over and start with you. Would you mind telling us a little bit of background and context about the screening diagnosis part and how you found out that you had cancer?
Yes. So it was probably August of 2023. I was taking the trash out and I was going outside and I have my car, my left breast hit the mirror. And I was like, oh, it hurt a little bit, but I, went on. And normally I should have, but I didn't check, monthly for mammograms. I was like, well, I'm 58. Not everything's going to be fine. But this particular time I went and checked and I felt a knot. And I was like, well, it's going to go away. So I went on with my life and went to Missouri with my friend Quilton and came back. The knot was still there. So I called my primary care doctor and she was like, okay, I need you to go and see the doctor. And I was like, okay. And of course, I still waited a couple of months. I was like, I'm going to just give it some time. And I said, well, maybe I need to go and do a mammogram. So, of course, I went to the facility to do a mammogram and I did the D2. And I asked him, the knot was still there. And I asked him, I said, is everything okay? And he's like, oh, yeah, everything's fine. I said, it's not cancer. He's like, oh, no, just come back in 6 months. So time went on, and then probably a few weeks later, I started seeing an indentation in my breast. And again, I called my doctor, my primary care, and she was like, no, you need to go see the oncologist. And I went to her, and she looked at me, and before even examining, um, she said, I'm pretty sure it's breast cancer, but let's go on and do the exam. And when she did the exam, she was like, the first thing she said was, I got you. And I was like, okay. She was like, well, let's go through all of the procedures and the mammograms again. And so we did that, and it was at stage 3B. Um, and I was like, okay. She was like, well, we need to get you started with a oncologist. And we went through the whole procedure of starting chemo. And I had 6 sessions of it. Second session, hair immediately came out. And I think that was my biggest thing because I've always loved my hair and it was long and So I had to really adjust to not having that. And because I work in childcare, my kids all knew me with long hair. And so when it started coming out, I just kept a cap on. So with that, every 3 weeks for 6 sessions, we did chemo.
Thank you for being willing to and brave enough to share. What I remember knowing you personally was definitely a challenging, hard time.
It was. My thought was um, having my oldest son with sickle cell and passing away. I had another son, they're 12 years apart, and I knew that I had to be strong and fight and let him know that I was okay. I was going to be okay. And I knew that God had me. And so when I would go on a Thursday for chemo, Friday I would take off and stay home, and I was back at work on Monday. And I knew my kids here needed me too. So, I didn't worry too much, but I was still scared. So actually, next Wednesday, I'm having my first mammogram um, after all of this that I went through. So we'll see how that goes.
And I will also say I always really admire the strength that I know that you took and the peace that I know that you found in your faith as you walked through it, because it it's beyond anything I can comprehend.
Yes.
Kayleen, coming over to you. Can you give us some background context about your story, particularly the diagnosis and screening?
Sure. So, for me, I wasn't old enough to be going to screenings yet. I didn't have any family history or anything. So, what happened is actually just I was laying in bed. It was actually the day after my 38th birthday. And I was laying in bed and just kind of went like this. And I was like, I I feel something here. Um, but I was still nursing my daughter. She was almost 2. She was 2 months shy of being 2 at the time. So at first I was like, oh, maybe it's just something, with that. But I was like, no, this feels like really big. And I texted my husband to come up and I said, hey, can you come feel me up? And he, laughed about it. And he said, yeah. And he came up and he's like, I don't know what that is. So it was a Sunday night. And so the next morning, I had actually just started a new job like the week before. So it was like my first Monday after starting my job. And I told my boss, I was like, hey, like, I need to run out. I was able to get an appointment at my OBGYN's office. And luckily they were like right next door. So I just ran over on my lunch break and was like, hey, I'm concerned about this. And it was, not a doctor I'd ever seen before, but he like, luckily he took it seriously. He's like, yeah, he's like, this feels more than like a mastitis thing. Like you're not, you don't have a fever, you don't really have any other symptoms, but this. So he said, yeah, we're going to send you, I'll, write for a screening, for you, or a diagnostic, test, I guess, rather than like a screening. So I'll send you for the diagnostic. And they ordered a mammogram and an ultrasound. And when I called to schedule, the woman, she's like, oh, you're still breastfeeding. She's like, we probably won't do the mammogram, but yeah, we'll just like do the ultrasound. And I was like, she's like, but you're there. I'll set aside time for both, like when you're there. And then that was like the longest wait of my life because like I got in the next day, for the lump, but then I had to wait almost 3 weeks to get that diagnostic ultrasound done. And then I went in on a Thursday night and they did the ultrasound and the tech's doing it. And she came she's like, oh, okay, I'm going to go get the radiologist to read your report, because I guess that's what they do when it's diagnostic. They read it right away at the facility I went to. And within like 2 minutes, that radiologist was in there, and she's like, so I'm going to do the mammogram after this, but she's like, based on your ultrasound, I want a biopsy. And we have one at 7:45 tomorrow morning. And it was like, oh, they don't, just give 7:45 a.m. ultrasounds to, people who they're mildly concerned about. So I was like, okay. So they did the mammogram too, and then she like came in and talked to me, which was like all a blur. It was, because it was like, okay, like now this is serious. And then the next, and then I'm still nursing my daughter too. So like now I'm all worried about like what's going to happen with that. And I went the next morning for the biopsy, and like, I can still hear the sounds of like the like the needle, the core needle thing that they have going in. It's like this loud punch sound. So they did that Friday morning, and they were like, normally the results come back in 2 days, but of course I did it on a Friday, so I had to wait, for the weekend. But then the results were released in like my portal on Tuesday, and I had they called it a site check scheduled for Wednesday, that, basically either a nurse would check the site or they would let me know. But I was like, no, I'm going to look at this because I have zero patience. And I had also already like convinced myself that it was cancer. And lo and behold, it was. So, I didn't really know what I was looking at, in the portal at that time, but I just saw, malignant, and that was it. So.
Thank you for sharing that. Follow-up question. How long did it take before you were able to hear back on the patient portal and the results of the biopsy?
Well, because I had the appointment scheduled the next day for the site check, what happened is I went into that appointment, but because I had already looked at it, I asked my husband to go with me just for like emotional support. And, they pull me back, and they immediately were like, oh, we're going to take you in this room where there's like 3 people waiting. There's the radiologist, there was a nurse in there, like, and this is the social worker. And I was like, well, if I didn't know I had cancer yet, I would know right at this moment. So, yeah.
My experience was so different because I learned from a lab, and my site check appointment wasn't for a week. So I didn't have anyone to talk to. That's amazing that you walked in and you had 3 people to talk to about it. I mean, I'm sorry that it happened, obviously, but I'm glad that it was handled appropriately, and that they gave you the imaging that you needed.
Yeah, I mean, like, I can say, like, I know, like, I'm pretty lucky that process went smoothly. Like, there's more stuff like later that I'm just like, this is all really weird. But I will say, like, in that appointment, like, I wanted a lot of information, and the radiologist was like, no, I'm not the one to like tell you this. And it was just like really frustrating because they didn't even have like, they just knew it was like cancer at that point, but they didn't have like the details back by the time that about if it was estrogen, or they just knew it was cancer. They didn't know like, all the stuff that it fed off of, and they were waiting on more information. And it was just like, oh gosh. But that at that appointment, they were already trying to schedule me for like, meeting with a surgeon and meeting with oncology and all of that stuff. So it all of a sudden it was like, okay, boom, like now we're rolling.
Wow.
Must have been a shock.
Definitely.
So I think this time, Kayleen, I'll come to you first, and then Karol, I'll come to you next. I would like to hear about any particular friction points that you encountered during the diagnosis and screening part, or any particular pain points, with the mindset of things that maybe we could even potentially improve within our healthcare experience for future people.
I mean, for diagnosis and screening, like I'm thinking that's in my brain, that's everything kind of like prior to when you're meeting with people to do a treatment plan. I mean, my portion of that was probably pretty straightforward. I did not luckily I did not receive a lot of pushback on that. I had heard horror stories about women that were breastfeeding, and I know like my sister, who is trying hold on. Yeah, she's 4.5 years older than me, and she was breastfeeding. Like, she hadn't even started her mammograms yet because she had always been breastfeeding a child since she was 40. So it was one of those things where it's like, and they would always tell her, "Oh, don't get one because it can be incorrect." So, I guess to me, that's the only thing where it's, I didn't experience that, but I definitely think that, especially for women that are breastfeeding, maybe there should be more discussion about that with them, or just more education about, to not just dismiss it as something related to breastfeeding. But I luckily didn't have that issue. They went boom 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 for me.
I'm so glad.
Yeah.
Karol, what about you?
So mine, when I went for the mammogram, to the first place and did the 2D, he told me it wasn't cancer. And I'm like, okay, are you sure? And he's like, yes, come back, in 6 months. If I had have listened to him and just went with what he said, I think it would have been worse than what it is now, because by the time my doctor said it was the size of an egg. And so if I had just listened to him, I wouldn't have even went to my primary care doctor, because I'm thinking, okay, it's nothing, because I said, well, should I do the 3D? He's like, no, just come back in 6 months. And so, and I was like, okay. But when I went to the my cancer doctor, she was like, no, I can tell, So I was glad that I, went on and followed up. And then I get a call in February of 2024 from that company saying, oh, it's time for you to get your mammogram. And I said, I have breast cancer. I said, the doctor that did my 2D said I didn't have it. And she was like, oh, I'm so sorry. Do you still want to get the mammogram? And I said, no. Yes.
Wait,
Yeah.
they asked you if you still wanted a mammogram after you all.
Oh, Karol, I'm so glad. I'm so, so glad you went somewhere else. I can't imagine how that must have made you feel.
Oh, yeah.
I did not know that part of your story. I knew the stage and everything, but wow. So, and it was, what type of doctor was it that looked at your mammogram and said, "Oh, it's not cancer"?
He was just the doctor at the
Probably a radiologist.
radiologist. Yes, that's exactly what it was. And because I said, well, are you sure it's not cancer? He said, oh, no, it's not at all. And I was like, oh, okay. And so I went on. But then as weeks passed and I started seeing, the indention, I said, something is not right.
And so then you went back to your primary caregiver with that mammogram.
Yes, and I told her. She was like, no, you definitely need to go see the hematology. And so we went, and then I went and did the mammogram at another location. And then the day that my son was graduating from DBU, I'm walking out the door to his graduation. She called and said, yes, you do have breast cancer. So I just had to be a big girl and say, okay, I got to go through this and watch my son graduate. And when we got home, because he's going to school uh, this spring for seminary. The first thing he said, "Mom, I got you," and he just prayed. He said, "You're gonna be okay."
I am so grateful that you advocated for yourself, and that there was that little voice inside that went, "No, I'm gonna follow up."
Yes.
Because something still doesn't seem right.
Right.
Wow. Me too. I'm so glad you're here with us. So glad you both are.
We'd like to give a big thank you to our guests, and we hope that you'll join us for the next episode. Context is everything, and healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out if you want to be on our show, or you think we should cover another topic. What did you learn from the show today? We want to hear from you. Contact us at hcincontext@gmail.com. Leave a comment or look us up at dwellnesscommunities.com. One of the most common questions I get asked as a cancer survivor is, what should I send to my loved one who was recently diagnosed? So that's why I helped create a curated list of products at dwellnesscommunities.com in the Shop tab. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of proceeds and donate it to Undo Medical Debt. For every dollar donated, it will pay off $100 of debt. It also helps us continue to share these stories with you. We wish you wellness. And if you aren't feeling well, remember, there are people out there working hard to make you feel better. See you soon. Until then, take care of yourself and stay cozy.